In this video, I will talk about hypertension and its clinical significance in relation to its diagnosis. First is a disclaimer: Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosing, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Hypertension or high blood pressure is becoming more common due to modern lifestyles and longer lifespans. Over 1.5 billion people worldwide they have high blood pressure, and most of them live in low economic countries. However, in small number of patients who are being treated actually have their blood pressure under control. About 23% of women and 18% of the men are affected. Even in rich countries, many cases of high blood pressure are not diagnosed or treated properly. This large number of people with uncontrolled high blood pressure leads to many heart and blood vessel diseases, and most guidelines still rely on blood pressure reading taken at clinic, or we can say office BP. But over the last 20 years, we have learned that office BP readings can be misleading. They may show high BP when it is actually normal, that is the white coat hypertension, or we may miss cases where BP is high at home and they are normal in office setting, and this is a masked hypertension. So office readings they don't always predict the heart problems accurately. That's why home blood pressure monitoring and 24-hour ambulatory blood pressure monitoring have become important part in diagnosing the blood pressure, high blood pressure. Ambulatory blood pressure monitoring is helpful tool for managing the high blood pressure. It gives us detailed information about the person's blood pressure during the day and night, along with other useful data. Ambulatory blood pressure monitoring is set to measure BP every 15 to 30 minutes during the daytime and every 30 to 60 minutes at night. So it can also be used to check the blood pressure during the specific events or symptoms. It is especially useful in the situations like white coat hypertension, masked hypertension, resistant hypertension, patients who present with syncope, autonomic nervous instability, or when we have to adjust the BP medications more accurately. It helps us to know day and night time BP levels, morning BP surges. If BP drops at night, we call it as a dipper pattern, or a major benefit is that it allows us to match BP readings with symptoms or events. However, it is more commonly available. It is not commonly available, and it can be expensive. Similarly, the home blood pressure monitoring. Here we measure the blood pressure at home as it is more easy to record, affordable, and it gives results similar to those taken at doctor's clinic. It is especially useful in diagnosing the white coat hypertension. That is means white coat hypertension is high blood pressure in the clinic, but when it is normal at home. It helps in diagnosing the masked hypertension when patients have fluctuating blood pressure at the clinic. Also useful to diagnose the resistant hypertension which are not controlled with the medications. For accurate home blood pressure monitoring, the patient should be educated about the high blood pressure. A proper BP device, validated upper arm type oscillometric method should be selected. The patient should be shown how to use it correctly. We should take two readings in the morning, 1 to 2 minutes apart, before breakfast and before taking any BP medications. We should take two readings in the evening before going to the bed, and we should do this for at least 3 days in a row. Ideally, it can be done 7 days. Important advice which is given to the patient is They should not overuse the device or change medication on their own. Nighttime BP can also be measured using special devices that record readings 3 hours after the sleep or set time like 2 a.m., 3 a.m., and 4 a.m. Taking 6 readings per night, however, two nights gives taking 6 readings per night over 2 nights gives results similar to 24-hour ambulatory blood pressure monitoring. Some devices which record the home blood pressure monitoring or ambulatory blood pressure monitor, they also track the body temperature and send the data directly to the consulting physician. Why the home blood pressure monitoring gives is effective? One of the study called Ohasama study, it was conducted in Japan. It showed that home blood pressure predicts the risk of stroke better than the clinic blood pressure. The honest study found that high morning blood pressure at home is better indicator of future heart problems than the office blood pressure readings. Morning home hypertension, when the blood pressure at the clinic is normal but it is high at the home in the morning, it is called masked hypertension, and this condition increases the risk of heart and blood vessel problem. If the morning home systolic blood pressure is 155 mm of mercury or higher, the risk of heart disease goes up to 6 times. In comparison, if the blood pressure is less than 160 mm of mercury, sorry, if the office BP is 160 mm of mercury or higher, the risk increases 3 times. The morning BP is also a better indicator of stroke risk than the clinic BP recording. Coming to the nighttime hypertension, earlier it was thought that only ambulatory blood pressure monitor could measure the blood pressure at night. Now advanced home BP monitors, they can also do these measurements. In most people, BP naturally drops at night and we call them as dippers. At night to daytime BP ratio of less than or equal to zero point 0.9 is considered normal. When the ratio is more than zero point 0.9, the person is non-dipper, and it is commonly seen in diabetes, chronic kidney disease, and the sleep apnea. The Osama study found that it was the first study to show that nighttime BP predicts the heart and stroke risk better than the daytime BP, and over 10.8 years, nighttime BP was a stronger predictor of the cardiovascular deaths. The J-HOP study found that higher sleep time was linked to heart damage markers like increased left ventricular mass index, albumin-urea, NT-proBNP, and arterial stiffness. And these links stayed strong even after adjusting for clinic morning and elevating the blood pressure. A 10 mm increase in night systolic blood pressure raises the risk of heart events. If we compare the home blood pressure monitor versus ambulatory blood pressure monitoring, it was seen that home blood pressure monitor showed higher night systolic blood pressure reading than ambulatory blood pressure monitoring. Nighttime systolic blood pressure more than 120 mm of mercury detected by home blood pressure monitor was strongly linked to future cardiovascular events with a hazard ratio of 1.78 for coronary artery disease and stroke and 2.65 for stroke alone. The ambulatory blood pressure monitor did not show such strong associations. Coming to the blood pressure variability, when the blood pressure doesn't stay constant, it varies in several ways. First is the circadian variation, like in the morning surge and the nighttime dipping. BP varies day to day. There can be long term variation, there can be variation because of change in season and change in temperature. Home blood pressure monitor or home blood pressure variability, that is fluctuation seen in the repeated home reading, has been shown to predict the both stroke and cardiovascular event. The J-HOP study showed that various types of BP variabilities are independently linked to CV risk even after adjusting for home systolic blood pressure. NT-proBNP or urinary albumin creatinine ratio, they are also the risk factor which are linked to CV risk. If there is greater variability, there is the greater risk. Cardiovascular risk and the home blood pressure monitor guidance. The home BP study was first to look at the outcomes in hypertensive patient managed using home BP monitoring. The key findings of this study was for every 1 point increase in standard deviation of the home blood pressure, the risk of CV death, stroke, and MI increases by 41 to 47%, regardless of the type of the antihypertensive used. If some systolic blood pressure, if home systolic blood pressure stayed less than equal to 131.6 mm of mercury, the 5-year risk of major cardiovascular event was under 1%. So, how do we diagnose the hypertension or high blood pressure, and what is the treatment recommendation? As per the European guidelines, the hypertension is defined as systolic blood pressure more than 140 mm of mercury and diastolic blood pressure more than equal to 90 mm mercury based on the office BP. And American Heart Association guidelines, they suggest hypertension is defined as systolic blood pressure more than 130 more than equal to 130 mm of mercury, or diastolic blood pressure more than equal to 80 mm of mercury is suggestive of hypertension. For BP 130 to 139 systolic and diastolic 80 to 89, the American Heart Association recommends the drug therapy if the patient has established cardiovascular disease or 10-year atherosclerotic cardiovascular disease risk is more than equal to 10%. Means if the blood pressure is between 130 to 139 systolic and diastolic blood pressure 80 to 89, if the patient has established cardiovascular disease, or when the 10 years ASCVD risk is more than equal to 10%, then we recommend the drug therapy. So the target blood pressure, as per the American Heart Association, the aim of the reduction of the blood pressure should be less than 130 by 80 mm of mercury, and for European hypertension guidelines, the target blood pressure is less than 140 by 90 mm of mercury. But if the treatment is well tolerated and if the BP is going below 130 by 80, it is acceptable. All the major guidelines, they agree on following indication for starting the antihypertensive medications. If the BP is more than 160 by 100 mm of mercury, we should always start the treatment regardless of other condition. If BP is more than 140 by 90, we should start the treatment if the patient has history of ischemic heart disease, stroke, or heart failure. If BP is more than equal to 140 by 90, we should start the BP antihypertensive medication if BP remains high after the lifestyle changes. So special consideration is given when BP recording at workplace BP recording at workplace should be taken into consideration if, as we know, that stress may cause higher reading there. Wearable BP devices that measure beat to beat BP accurately and send data to the clinician are under development, but current ones are not reliable yet. Home BP monitoring advances. Japan is the leading in development of the home blood pressure monitor devices. This is the comparison of home blood pressure BP corresponding to a clinical blood pressure. The morning BP of home reading is 120 by 80, clinic BP 120 by 80, evening BP of home blood pressure 120 by 80, nighttime BP of 100 by 65, that should correspond to clinic BP of 120 by 80. Similarly, the other readings are also mentioned. So, in conclusion, a large number of people with hypertension still have uncontrolled BP worldwide. The office BP measurements alone are not enough because they may overdiagnose. They may miss real cases like masked hypertension, morning BP surge. They cannot capture the nighttime blood pressure. Therefore, it is essential to measure the BP at home if possible at workplace and in different times of the day and night using the ambulatory blood pressure monitor or home BP monitorings. Using the ambulatory blood pressure or home BP monitoring, it helps in better control of hypertension. It reduces the complication, disability, and death. These are the few article which I suggest for reading. The patient is not just a case, but a person. Respect their story. With this, I conclude my today's topic. Thank you. Keep learning.